And so it seems like sort of the question of the day or the question of the week has been about acne. Not really sure why. It's just the way, it is. All of a sudden I'm getting a bunch of questions about acne. So I thought I'd talk about that, about menopause, perimenopause, hormone replacement therapy, and acne, and how that all plays together. And for a lot of women, maybe they had acne, when they were going through puberty, and then their skin was fine, and then all of a sudden now they're breaking out again, or they weren't even breaking out again, and then they start hormone replacement therapy and they start to have acne. So what's up with that, and why is that happening, and how can we fix it? So there's sort of three categories in my mind. The first are women that get acne because of their menopause or perimenopausal status, and so maybe you haven't had acne, maybe now and then you have a pimple here and there, but you really haven't had a problem. And then all of a sudden you notice as you're getting your other perimenopausal symptoms, acne becomes one of those symptoms. And that's actually pretty common. And the thing is that the skin is an organ, like your heart or your liver or your lungs. And it's actually the biggest organ in the body. And it's very complicated. There are people that's all they do is skin, and dermatologists, for instance. So it's a complicated organ, the skin is, and it's very active and it's very sensitive, and it has a lot of receptors, has a lot of sensitivity to the various hormones, and particularly estrogen, but also progesterone and testosterone. And so one of the things about the time around menopause, this menopause transition, is not just that the hormone levels start decreasing. They don't decrease in a nice, smooth, steady fashion. If they did, things would be a lot better, honestly. They kind of come in spits and up and down. And so the ovary is producing less hormone, and then it sort of spits out a bunch of hormone all at once, and then it kind of goes dormant again. And it's almost like the dying gas of the ovary trying to get this hormone out. And these rapid changes in hormone levels can be really disruptive in the body. And the thinking is that's a big part of why women start getting acne again during the menopause transition. It's sort of similar to puberty. So in puberty, there's this huge transition of all of a sudden these increased hormones, and again, not completely nice and steady, but in sort of spurts. And so people get acne then. A lot of women experience acne around their periods, and it's really for the same reason, because hormone levels change abruptly. And so we see that. It's one of the reasons people get hot flashes, is these abrupt changes in hormone levels. And so these abrupt acute changes in the perimenopause period and the menopause transition can cause acne, because you get this disruption of this, what the skin is used to, of this nice, easy flow of hormone, this nice normal state, and all of a sudden it's all different, and that can make the skin break out. The treatment for that type of acne is hormone replacement therapy, because what it does is not only does it bring the hormones back to where they're supposed to be in the youthful levels, but it keeps them at a nice, relatively stable level, where that's what it's designed to do anyway. And so now, instead of having these spikes of hormone, you have this nice steady hormone level, and that helps the glands in the skin so that they don't produce acne. And so hormone replacement therapy can be a good treatment for acne. So that's sort of category one. Category two, some women will find when they first start the hormone replacement therapy, or when they make a change in their dose, all of a sudden they get acne. So maybe they weren't getting it from the menopause transition. They were doing fine. And all of a sudden, they start one of our hormone creams or pills, and next thing you know, oh my gosh, I'm breaking out. And that's annoying. And I totally understand why, I wouldn't like that either. And that's, again, it's from an abrupt change in the hormone level. So you're cruising down at this low hormone level that's giving you side effects, giving you symptoms. We're bringing that hormone level back up to relieve those symptoms. But in that transition state where we're first starting your HRT, or if we have to increase or decrease the dose, so there's this rapid change in dosage, that can again stimulate the glands and cause acne. That should go away relatively quickly. So it takes a little while for the body to adjust to the new hormone levels, but once the body adjusts, it tends to level out, and that acne goes away. One of the frustrating things from my end, and I'm sure from your end as well, is that side effects tend to come up very quickly when you start a new medication, particularly with HRT. The benefits can take a while to come along. So you start this new medicine, all of a sudden you're getting, breakouts or some other side effect. It's frustrating because you aren't feeling the benefit. If you can stay the course and work through that and keep on the medicine, eventually those side effects go away, and then you start reaping the benefits and you start feeling much better. So it's easy to say, it's hard to do, but if you can push through, that acne side effect, it almost always goes away fairly quickly. And then you're on a nice stable dose again, and it should help actually prevent acne. So that's number 2. Number 3 is a little more rare, but it does happen from time to time. And that is women that are on hormone replacement therapy for a while now. They haven't changed their dose. They haven't been missing dosages. They're on a nice stable HRT, and all of a sudden they start getting breakouts. And that's really a different thing. And honestly, it's a little less understood, but this is the way I wrap my brain around it. In the menopausal state, the skin becomes very thin, the glands become inactive, and it's almost like sort of this dying organ that's not active anymore. The collagen decreases, the skin sags, you get wrinkles, it's thin, it looks sort of dry and old, and that's one of the reasons that people sort of age very quickly, as far as appearance, sometimes during this menopause transition. One of the real big benefits of HRT is that it improves the skin and it gets that skin looking young and healthy again. To be honest, I think that's my wife's favorite part of our hormone cream, is she really loves the way it makes her skin look. And it does. It increases the collagen, thickens the skin, gives it that nice, healthy sort of glow about it. It helps smooth out the wrinkles because you have more collagen. But part of that increased health of the skin is that some of the glands become healthy again. So the sebaceous glands and the other glands in the skin, that were sort of old and dried out, are now healthy again. And those glands can get plugged and produce acne. So I think that's why some women get acne, even being on hormone replacement therapy for a long time. So it's sort of, that's sort of the downside of having, young, healthy skin, is young, healthy skin sometimes gets acne. And so you can treat that acne the way you would treat acne in other situations. Tretinoin cream, see a dermatologist or the doctor to get that. Or, the other over-the-counter acne medications can help with that. But that's sort of a trade-off of having young, healthy skin. Not for everybody, and I'd say really the minority. Most people don't get this, but occasionally people do, and it's annoying. But it's sort of a trade-off that you end up having to decide if that's what you want. So those are sort of the 3 categories, the way I think of it in my head, of why acne comes about in the perimenopause and menopause transition, and all really for different reasons. But I hope that helps. And if someone has follow-up questions about that, I'm happy to answer them.